especially if we're talking about advanced cancer, stage 4, am I going to die from this? Am I going to die in pain? So these are the common questions that patients may struggle with, and yet they have no outlet to express it.
And another thing I'd like to add is you should set some time for yourself if you're a caregiver with lung cancer. Self-care is so important.
Hi, everyone. Thank you so much for joining us on this very special session of A Caregiver's Guide to Supporting a Loved One Through Lung Cancer. This is a very special conversation that we're bringing to you in conjunction with the Lung Cancer Network of Malaysia, supported by Pfizer Malaysia. And what we're going to be doing today is having a conversation that perhaps isn't spoken about as often as it should be, and that is the difficult questions that can come up when you are supporting a loved one through an end-stage disease or a life-limiting disease. And in order to be able to do that, we've got two very amazing doctors with us here today. We've got Dr. Caryn Khoo, who's a palliative medicine physician, and we've got Dr. Caryn Chun, who is a senior lecturer and psychologist. Both of them are with the Lung Cancer Network of Malaysia. Now, why lung cancer? Well, November is Lung Cancer Awareness Month, so no better time than right now to have this conversation. Now, in case you did not know this already, lung cancer is actually the leading cause of cancer deaths in the world. Despite this, many people know very little about this disease, and they are not equipped with the knowledge to cope with the diagnosis, which is often unexpected and can be overwhelming, as you can imagine. Oftentimes, it can be so hard to find the right words when a friend or a loved one receives a cancer diagnosis. Really, what do you say to them? Well, we're going to be speaking about that a little bit more in detail today. Dr. Khoo, Dr. Chan, it's a privilege to have the both of you here with me today. Thank you so much. Maybe I'll get us started off with a quick introduction from the both of you. Dr. Chan, start us off. Tell us a little bit about the work that you do and how you got involved with the Lung Cancer Network Malaysia.
My name is Dr. Caryn Chan, and I am a psychologist with University Kebangsaan Malaysia. So my focus and expertise is basically empowering and educating patients living with chronic illness. I focus mostly on patients with cancer as well as the caregivers, and this very much ties in with the goals and objectives of LCNM Malaysia as well. So some of the things I focus on are anxiety, depression, and post-traumatic stress disorder among patients with cancer, and other things that I focus on include adaptation and adherence as well.
Dr. Khoo, tell us a little bit about the work that you do, as well as your involvement with the Lung Cancer Network Malaysia.
Thanks, Sumi. Thanks for having us here. So I'm a palliative care physician. I'm with Sunway Medical Center. I've been there for almost 1.5 years now. So the work that we do in palliative care is really about supporting patients with serious illnesses like lung cancer. And I was really thrilled to be asked to join the LCNM, as it is recognized that palliative care is an important part of a cancer patient's treatment. Even as they're going through treatment like chemotherapy, radiotherapy, a lot of times symptoms like pain and breathlessness may arise. And palliative care is about optimizing or minimizing these symptoms to help them have a better quality of life, walking with them through the cancer journey. And I was also really thrilled to be asked to pen a few lines in this patient guide that we're kind of showcasing today. Yes. So there's a bit of palliative care in it. And perhaps I can tell you a little bit about this guide. It's the first ever digital guide for patients with lung cancer. It's meant to provide some degree of information to patients as well as their caregivers, because I think this is certainly something that is really lacking in Malaysia, the awareness, the knowledge about lung cancer, and especially resources that cater to the lay public. So this guide is catered to Malaysian public. It's available in 3 languages, English, Bahasa Malaysia, as well as Mandarin, with the goals of empowering patients and their families in their cancer journey. So it was done in collaboration with NCSM and supported by Pfizer.
We've been talking a little bit about caregivers already. And, when you say the word caregiver to, a layperson, for example, they would immediately think, oh, well, I just suppose it means that if somebody is ill, I just need to be there to help them with their medicine and drive them around. But that's not really true, because the role of a caregiver is actually far more than that. Dr. Chan, perhaps you could just start us off by saying, or by letting us know, what are some of the roles that a caregiver needs to take on in caring for a patient with lung cancer or with any life-limiting disease, really?
Thanks for the question, Sumi. I think it's important to remember that the role of a caregiver to any patient with cancer is very multifaceted. They are often the ones, caregiving is a 24/7 task. There's often no breaks, no rest, no respite from it. And it's not just about catering to the physical needs and handling logistical issues, shepherding patients to their appointments and so on and so forth, keeping track of medications. But there's also a need to cater to their psychological and emotional needs as well. So in this respect, the thing is, receiving a cancer diagnosis is oftentimes very scary for both the patients and also the caregiver. Because a lot of the time, patients, they have difficulties discussing about their condition, about lung cancer, and they're oftentimes very lost and very worried once they get the diagnosis. And for caregivers also, it's often a very anxious, very stressful, very, sometimes they get depressed from it, and sometimes it can be traumatic because being diagnosed with lung cancer is often very sudden. It's not something you anticipate. So as a caregiver, I think it's important that the whole point of this session here is to remember what it's like. Remember that caregivers need care as well, not just patients. And so as a caregiver, they need to recognize and acknowledge the different kinds of sufferings that the patients go through. And also you need to realize how to equip yourself with the kind of knowledge from sources that are both legitimate and credible. So to help with clarity when it comes to supporting your loved one with cancer through this long journey.
Thank you for that, Dr. Chan. Dr. Khoo, Dr. Chan mentioned something very interesting, that it's really important for caregivers to acknowledge suffering. I must admit, this is kind of a novel concept. Usually when we talk about suffering, which is a very human condition, it's also a very terrifying condition. Nobody wants to actually acknowledge that I am suffering or that somebody else is suffering. Everybody just wants to be able to say, well, let's just do something to make sure that people are not suffering. But that's not really possible in the face of a cancer diagnosis. How does one exactly recognize and acknowledge suffering?
That's a very good point, actually. And before we address how do we deal with that, I think it's important to first define it. I think suffering comes on many levels. Of course, the most obvious one to anybody is the physical suffering, as I mentioned earlier, the pain, the breathlessness, the nausea. But beyond that, there are multiple other dimensions as well, the psychological or emotional suffering, the spiritual suffering, as well as the social suffering. So there's a concept that, is termed total pain or total suffering, that covers all these different facets of suffering, the physical, psychological, social, and spiritual. And what we know is that all these components actually contribute to the actual experience of suffering by a patient. And oftentimes, if there are many unresolved issues in one dimension, it's hard to actually tackle the other. So for example, if there's a lot of psychological distress, the physical pain that's experienced by the patient may be more complex and difficult to manage. So how do we tackle this? I think, first of all, we have to first recognize it. So how does one recognize it? I think taking the time to speak with the patient, understanding that the doctor's perspective far differs from the patient's perspective. So we actually have to take the time, sit down with them, try to gain their perspectives on their illness experience. And sometimes even their family members may not truly understand what they're going through. So it takes time, and as we delve through things, even the act of just listening, active listening, does help to calm some of the nerves, to help them release some of the stress. But beyond that, acknowledging that what they're going through is not easy. There's no one-size-fits-all kind of solution. So we have to tailor it to the individual patients. The psychological distress oftentimes stems from feelings of fear, of the unknown. Cancer for many people is a very foreign concept. They may have heard of it, but they've not had any personal experience. So there may be a lot of fears. What's going to happen to me now? Especially if we're talking about advanced cancer, stage 4. Am I going to die from this? Am I going to die in pain? So these are the common questions that patients may struggle with, and yet they have no outlet to express it. Doctors, the regular doctors may be too busy to actually address some of these questions, and their loved ones may actually dismiss these questions.
Yes.
Don't worry, mom, it's okay. Everything will be fine, which is, done out of love, but it's also false assurance that doesn't get to the root of the problem. So palliative care actually utilizes a sort of a holistic approach. We look into all these 4 dimensions. Palliative care is provided by a team, not just of doctors, but of nurses. Some places you may have other members like a social worker, a psychologist, looking at recognizing, first of all, identifying some of these sufferings, recognizing it and trying to manage it through sometimes medications to treat pain, but sometimes non-medication type of interventions as well. So a very long answer to your question. I hope that addresses that.
Very complete answer. So, Dr. Chan, Dr. Khoo has just been speaking about acknowledging patient suffering. Perhaps caregiver suffering is not acknowledged enough either. What are your thoughts on this?
Yeah, I absolutely agree with you on this, because caregivers are so often so busy caring for others that they tend to neglect their very own emotional and physical and spiritual health. So, and this takes a toll on the caregiver in terms of their own health, because they can end up overwhelmed very easily, and end up fatigued, and end up feeling like they're in a hopeless and helpless position. And ultimately they end up with burnout. So burnout, the thing is here, is something that occurs when the caregiver doesn't get the help that they need. So if they try to do more than they're able to, physically, financially, emotionally, a lot of them, the thing is, they tend to feel guilty about spending time on themselves rather than on the ill or elderly loved ones. So there are quite a number of things we can do though to prevent this kind of caregiver burnout. So some of the things you can do is like to set realistic goals, like to accept that you may need help with caregiving and to turn to others for support. So you need to ask for support, and if need be, talk to a professional. Because most therapists and social workers, they're trained to counsel individuals dealing with a wide range of physical and emotional issues. Another thing you can do is to ensure that you educate yourself. The more you know about the illness, about what the patient's going through, and that what you're going through is absolutely normal, the more effective you will be in caring for patients. So also, I think it helps to be realistic about your loved one's illness, about the lung cancer itself, especially if we're talking about progressive disease. And another thing I'd like to add is you should set some time for yourself if you're a caregiver with lung cancer. Self-care is so important. And it's not just about, even if it's just like 15 minutes a day, an hour or 2 a day, we can manage it. Arrange for someone to take over for you, to step in, because it's not just about taking a grand holiday every 6 months or so, because you need help on day to day, not just every once in a while. So the key here is to taking care of yourself and remembering that it's not luxury. It's something we need, and it's an absolute necessity.
Dr. Khoo, I mentioned to a couple of friends that I was going to be speaking to the both of you about this topic, and they were like, "Oh, why are you talking about end of life things with doctors?" And that idea that palliative care is for people who are at the end of their lives is a pretty common misconception, I would say. Would you like to weigh in on this?
Yes, certainly, and I think that is possibly one of the biggest barrier to us, getting to know the patient early on, because a lot of people, and sometimes even doctors themselves, associate palliative care to end of life when the treatments don't work anymore. But actually, that's very far from the truth, because palliative care, it's not about death and dying. And I feel that it's the complete opposite of that. Palliative care is about optimizing the living, helping one live as well as possible, despite your illness, in the time that you have. So the time that you have depends on the stage of the disease, the success of the treatments, and so on and so forth. So those are biological factors. Palliative care itself is about helping, as I mentioned, to minimize pain and other forms of suffering, so that patients are able to carry on with their treatment, go on with the chemotherapy. Sometimes if they're in so much pain, they're so nauseated, treatments get delayed, chemotherapy sessions are postponed or radiotherapy sessions are postponed. And that means, their treatment itself is suboptimal. But with the involvement of palliative care teams early on to make sure these symptoms are controlled, it helps them get back on that treatment plan. And aside from the physical symptoms, a big part of what palliative care providers do is provide support to the patient as well as family. As I mentioned, a lot of times people struggle with the psychological burden of the disease. Having somebody walk with you in that journey can be very comforting. So the integrated model of palliative care actually means that palliative care should be involved at the moment of a diagnosis of advanced illness. It is not at the end. And certainly over time, perhaps our involvement may get larger as the disease progresses. But we walk with the patient throughout their cancer journey until the end. That's true. We do stay with the patient until the end. And then after the unfortunate passing of the patient, we do provide support to the family members as well. That's called bereavement care, to make sure that the surviving family members are able, at least in part, to get back to their lives without any evidence of pathological grief that may lead into depression and other things.
There's one aspect of palliative care that I'd like to get your opinion on. Many years ago, when my grandmother was still alive, she was fairly aged, but she had this little quirk, and perhaps it was not just a very uncommon quirk. She used to say to me that I don't want to talk about death and dying, and I don't want to talk about wills, and I don't want to talk about hospitals, because that's just going to speed up the process. And I think this is something that sometimes comes up when you bring up the subject of palliative care, that, speaking to a patient about these depressing things is just going to start them on a slide. What would you say to patients or caregivers who, share this kind of a point of view with you?
So again, I think there's a distinction here. There's a difference between palliative care and about talking about death and dying. Certainly in palliative care, we do talk and help patients prepare for the inevitable, the dying process. But it doesn't mean that we have to do it. So it really depends if a patient is ready, if they want to talk about it. Hence, I mentioned earlier that it's a very individualized kind of a patient-centered care. On the topic of death and dying itself, it's certainly a taboo, I feel, in our Asian culture especially. Now, I trained in the US and people were very open and forthcoming, wanting to talk about death and dying even at the start, But in Malaysia, in our Asian population, it's a different scenario, especially if we're talking about older generation. They may not want to talk about it that much, or actually some of them will talk about it as a matter of fact. So you can't stereotype. I think it has to be patient specific. If patients themselves are asking questions about, well, what's going to happen if my cancer progresses and all that, then we should broach that subject with them, because they may have things that they're worried about, or they may have things that are important to them to inform the family about things. Things they may want done at the time that they're close to dying. Certain people may have certain preferences about where they would want to have their final moments, whether in the hospital or at home. They may have their own ideas about what sort of ceremonies they may want. But certainly that's not a topic for everyone. There are people who would tell us, I don't want to talk about that.
Right.
And that's fine. That's fine. I think there's no right or wrong thing here. But certainly talking about death and dying doesn't speed up the process.
Dr. Chan, I wanted you to weigh in on this as well, specifically from a point of view of something else that a friend once told me, that her mother had advanced stage cancer, and the time had come for them to have this conversation about palliative care. But she said that she couldn't bring herself to do it because she felt that even broaching the subject felt like she was giving up on her mother, and she wasn't, but she had those feelings. And how do you console, or how do you kind of, help somebody through those feelings?
Okay, thank you for that question. I think it's difficult to broach the topic sometimes, to have these in-of-life conversations, because ultimately it's the fear of taking away hope from the patients, I think. That's why they don't want to do it. And there's also a lot of guilt there. It sounds almost as if like, oh, are you wishing for my husband death? From the point, yeah, the caregiver tends to worry that the patient may take it that way. And it's absolutely typically not meant that way at all.
No.
So, but it's also important to remember that if a patient doesn't want to talk about dying, we can't force it on them. We have to pretty much abide by their wishes, go by what they want. And but I think the important thing here is to let them know that, if you do wish to talk about it later on, I'm open to it and I'm comfortable about discussing this with you.
Right. So I actually have some facts and figures and some numbers with regards to what we've just been talking about, because in a recent study conducted by the Lung Cancer Network Malaysia, 88% of respondents felt a lung cancer patient may have difficulty discussing their condition or feel lost and worried upon learning their diagnosis. 61% acknowledge that poor awareness of the disease and available treatment options is a barrier to seeking early effective treatment or early effective intervention. So, Dr. Chan, what I'd like for you to perhaps explain is, how can patients and caregivers both equip themselves for the best possible outcome in what is potentially a very bleak situation?
Okay, so basically the vast volume of information that's available on the internet and social media these days can be daunting. It's a lot to digest. And the problem is that sometimes it can be misleading as well. So one key thing to tackle this is through increasing health literacy to resources like our lung cancer patient guide, because it can help facilitate better communication between patients and caregivers, as well as with the healthcare professionals, their providers. So one thing we hope is that for this guide to be able to help demystify the disease, lung cancer itself, and to empower patients and their caregivers to make informed and appropriate choices for the cancer journey, with of course guidance from their oncologists and the doctors as well. So because a well-informed person can, if you have a higher level of health literacy, you can make better and more articulate choices in their cancer care and support, which is actually key to patient-centered care, key to better patient outcomes. So one thing, we like to stress that we really encourage patients and your loved ones to use this patient guide to help you in your cancer journey, because we want you to learn to be your own advocate. So don't be afraid to speak up when you have any doubts. Always research for more information from sources that are credible and that are legitimate. So don't be afraid to ask questions and to maintain open dialogue with your doctors about your needs. Let them know what you need, because even psychologists, we can't read people's minds. You have to let them know what you need.
Fair enough. Dr. Khoo, would you like to kind of pitch in on this topic as well? I'm particularly very interested in trying to pull family members away from consulting Dr. WhatsApp for all of their, questions and concerns, and instead consulting actual trained registered medical professionals.
Yeah, absolutely. I think now in this era where information is really at your fingertips, you really need to be able to discern what is good information and what is not. So, anyone can Google anything, but you need to be able to know which are reputable sites to look up, health organizations, established hospitals, Mayo Clinic will be like one of those sources, and get your information from, credible sources, not just testimonials, because I think testimonials abound, and people basically they'll say anything, and you can't really trust in the testimonies of your friends, aunts, neighbors, and such. So it's important. And I think earlier when you talked about helping family members broach the topic of death and dying is also important. If they're not ready, but there are other things you can do to sort of gauge their readiness, in the sense that You can ask them, what are your thoughts about your cancer? You know, we just came back from the oncologist. The PET scan shows such and such. Are you worried? What are your concerns? What do you think is going on? So those are kind of good, stepping stones to getting them to open the door to have that conversation, because you can't really go up to somebody and sort of say, let's talk about death and dying. It's too abrupt, it's too direct, right? It's too upsetting.
Yes.
But sometimes you can use those little stepping stones to ask, what are you worried about? You know, or if a loved one, a family member, a relative had died from cancer, ask them, what was their experience of that? How do they think that went? That's less threatening, I think, especially in our very conservative Asian culture. You can't really say things very directly, but those are stepping stones to opening the conversation.
And this has been a completely enlightening conversation, and you're absolutely spot on about how, you know, these are the stepping stones to having the bigger, the more difficult conversations, perhaps. And I certainly hope that people who are watching this video will be able to take away something valuable about being a caregiver and supporting their loved one through their cancer journey. You know, remember, you know, if you are a caregiver, if you're a patient, you're not alone in this journey. There are various resources to navigate your lung cancer journey. You can speak to your doctor to learn more about your options, about whether it's about treatment, financing, or even emotional support. And on that note, Dr. Khoo, Dr. Chan, thank you so much for spending time with me today and sharing your knowledge. I'm sure many of us will benefit from this video going out and being shared.
Thank you for having us here.
Yes, thank you so much for having us, Sumi. Pleasure's all ours.
Pleasure was mine too. With that said, we're happy to share again that the Lung Cancer Network Malaysia and the National Cancer Society of Malaysia, supported by Pfizer, has launched Malaysia's first ever digital lung cancer patient guide. This is the actual hard copy, but there is a link that you can download. Now, the patient guide is actually catered to members of the public. It's very easily written. It's got infographics in it, and it includes very layman-friendly insights on lung cancer with illustrations, and it's available in English, Malay, and Mandarin. Welcome everybody to share it with your loved ones so that we can increase health literacy of lung cancer and safeguard our loved ones. The patient guide is now available for download at the LCNM website, and you can just head over to www.lungcancer.net.my, and you'll be able to find the link for the digital patient guide. And that's it. Thank you, everybody, for making yourselves available for today's session, and take care.
Thank you.
Bye.